Today we'll be looking at a specific genetic disorder called achondroplasia. Genetic disorders are defined as diseases that are caused by abnormalities in an individual's DNA. What has caused their short stature, and how does society treat those affected?
First, we'll be delving into what separates achondroplasia from similar disorders. We will explore how many people have this disorder, what symptoms and complications they have, as well as the biological inner workings of this complex mutation. We will close the presentation with societal and cultural views on those affected. Enjoy!
Achondroplasia is a disorder of bone growth. The word literally means without cartilage formation. It is considered a form of short-limbed dwarfism. Dwarfism is defined as an adult less than 4 feet 10 inches. It can be the result of 200 different medical conditions. Therefore, if someone is dwarfism, it is not necessarily they mean they have achondroplasia.
Achondroplasia is the most common type of short-limbed dwarfism. The condition occurs in 1 in 15,000 to 40,000 newborns. Dwarfism, or a subtype of dwarfism, affects less than 200,000 people in the U.S. population, and therefore both are considered rare diseases. Most people who have the disease are average-sized parents and do not pass on the gene unless both he or she has had a child with someone who also has the disorder.
For those who are affected with this disease, forming cartilage is not an issue, but converting it to bone through a biological process called ossification is where the difficulty lies. They have short arms and legs, and particularly short upper arms, thighs, limited motion at the elbows, and a large forehead. Ultrasounds can show these small shapes and indicate the disorder.
This genetic disorder is found in the 4th chromosome. The disorder is caused by a gene mutation in the FGFR3 gene, which creates a protein called fibroblast growth factor receptor 3. This is essential in converting cartilage to bone. FGFR3 is the only gene connected with achondroplasia. All people who have only a single copy of the FGFR3 gene and a single copy of the FGFR3 mutation have achondroplasia. Most cases of achondroplasia are not inherited. When achondroplasia is inherited, it is inherited in an autosomal dominant manner. In an autosomal dominant disorder, the mutated gene is a dominant gene housed on one of the non-sex chromosomes. A person with an autosomal dominant disorder has a 50% chance of having an affected child with one mutated dominant gene and a 50% chance of having an unaffected child, which would have the recessive gene.
Genetic testing can detect homozygosy, wherein 2 copies of the gene are inherited. This is important because homozygosy of the gene can lead to stillbirths. This disorder can be detected before birth by the use of ultrasounds. After birth, MRI or CT scans can determine the amount of severe muscle weakness or indication of the spinal cord compression.
Although scientists officially discovered the disorder in the year 1944, the ancient Egyptians were the first to record the existence of shorter-limbed people. We know that achondroplasia is found on the 4th chromosome as a dominant trait. What has been scientifically proven is that people with this disorder are generally very short and often at risk for many other health issues. French physician and scientist Pierre Maroteau found a link between genetic conditions and prenatal micromelic of the patients. Dr. John Wasmuth and his team were researching dwarfism in 1994 and surmised that the cause of this kind of dwarfism was primarily due to the fibroblast growth factor receptor 3 gene. There is no known treatment for achondroplasia, even though the cause for the mutation in the growth factor receptor has been found. The human growth hormone, although used with this disorder, does not help people with achondroplasia long term. The controversial surgery of limb lengthening can extend the legs and arms of someone with the disorder. Gene-based therapy may possibly serve as a future treatment option.
Many suffer from sleep apnea, a disorder that causes stopping and starting of breathing while sleeping. Obesity, recurrent ear infections, and permanent swelling of the lower back are also common for its medical conditions. A particular serious consequence of this disorder is spinal stenosis, which makes walking difficult. Hydroplasias, which is an accumulation of fluid in the brain, can affect young children and lead to enlarged head or brain deformations.
In ancient Egypt, several dwarves were members of households and high officials and were esteemed enough to receive lavish burial sites in the royal cemetery close to the pyramids. Ancient Egyptians worshipped dwarf gods. Bes, an ancient Egyptian deity, worshipped as a protector of households and in particular of mothers and children and childbirth. Bes later came to be regarded as the defender of everything good and the enemy of all that is bad.
The Germanic people had different myths regarding dwarfs of different races. They all looked like little old men and were all master at the crafts. White dwarfs were good-natured and generally helpful. Brown dwarfs were very mischievous, and black dwarfs were evil, crafting mighty weapons for despicable acts. However, Germanic views of dwarves soon changed terribly, especially when Hitler came to power. He set out to kill anybody with a physical or mental disability because their lives are a burden to society.
Those afflicted with achondroplasia have to avoid activities in which there is risk of injury to the head, such as collision sports. Use of a trampoline, diving from diving boards, vaulting and gymnastics, and hanging upside down from the knees or the feet on playground equipment are heavily restricted. However, the Dwarf Athletic Association of America, the DAAA, organizes competitions at annual convention in the Little People of America.
Many people perceive dwarves as a laughing matter or take social issues into their own hands. Recently, there's been debate whether dwarf tossing should be legal or not. Dwarf tossing is when a little dwarf gets tossed into a mat as a game. Little people associate and find this very offensive and strive to make this sport illegal. Other dwarfs see it as an opportunity to let their size get them famous, just as a 7-foot person in the NBA.
In China 2010, Chen Mingjing opened a theme park of dwarves called the Kingdom of Little People. He charged others $9 to watch those of small stature wear costumes and perform slapstick versions of Swan Lake and skits. The theme park had miniature versions of everything, including landscape. A representative for the Little People of America commented, "What is the difference between this and a zoo?" When interviewed, workers expressed gratitude and joy at having a community behind them at last.
Unlike most of the other diseases, people who have achondroplasia are often perfectly functional and do not need people to watch over them. People with this disease are perfectly functional people who may have physical issues but can function perfectly fine mentally.
If people with achondroplasia ever need assistance, there are groups such as the LPA, Little People of America, who are there to answer or help them in any way. Growing Stronger is another group out there whose mission is to improve the quality of medical care for people. Through nonprofit donations, Growing Stronger supports the cause to treat dwarfism. Achondroplasia is the most common cause of dwarfism, affecting 7% of those who identify as little people. Caused by the presence of a defective allele in the genome, achondroplasia spurs a mutation that inhibits bone growth. We hope that this presentation has allowed you to explore achondroplasia and the lives of those affected.